Welcome and thank you for placing your trust in us today. If you just completed your dental implant surgery, this video will guide you through what to expect over the next few days and how to care for the area and protect your healing. Firstly, and most importantly, please take a moment to relax. Everything that you're feeling right now is completely normal. It is completely normal to experience light bleeding and oozing for the first few hours after surgery. You've been provided with a sterile gauze. To use it correctly, fold the gauze into a firm, compact pad. Place it directly over the implant site. Bite down with steady pressure for 20 to 30 minutes. Avoid talking or checking it during this time. If bleeding continues, replace with a fresh piece and repeat. Mild oozing is expected. Heavy persistent bleeding is not, and if that occurs, please contact us. For the first 24 hours, it's very important to rest. Please avoid heavy lifting, gym or intense exercise, and repeated bending down. These activities can increase blood pressure to the surgical area and disturb early clot stability. They may also increase sinus pressure if your implant was placed in the upper jaw. When resting or sleeping tonight, keep your head slightly elevated using an extra pillow. This helps reduce swelling and supports bleeding control. Some swelling is expected. It usually peaks between 48 and 72 hours before gradually settling down. To minimize the swelling, apply a cold compress to the outside of your face. 10 minutes on, 10 minutes off. Continue during the first day. Always wrap the ice in a cloth. Never place it directly on the skin. As the numbness begins to wear off, you may experience some discomfort. Take your prescribed pain relief before the anaesthetic fully fades. It's better to stay ahead of discomfort. If you've been prescribed antibiotics, please complete the full course. Very importantly, avoid alcohol for 10 days. Alcohol can increase bleeding, delay healing, and interfere with the antibiotics or anti-inflammatory medication. For the first 24 hours, stay with soft, cold foods. Suitable options include yogurt, scrambled eggs, soup, cool, not hot, mashed potato, smoothies without a straw. Avoid hot foods and hot drinks today. Do not chew directly on the implant site for several weeks. If you've been fitted with a temporary crown or temporary denture, please remember it's provided mainly for aesthetic purposes during healing. For the first 3 weeks, avoid biting directly on this area. Continue following a soft diet. Protecting it during this early phase supports proper healing and long-term implant success. For the first 24 hours, please avoid vigorous rinsing, spitting forcefully, drinking through a straw, and smoking. These actions create pressure inside the mouth and can disturb the healing clot. Smoking significantly increases the risk of implant failure during healing. Good hygiene is essential, but it must be gentle. You may brush your other teeth as normal tonight. Around the implant site, use a soft toothbrush. Clean gently. Do not scrub the surgical area. From tomorrow evening, begin gentle, warm saltwater rinses. Allow the water to move passively around your mouth. Do not swish forcefully. If sutures were placed today, they may either dissolve naturally or be removed at your review appointment. If one feels slightly loose, this is usually not urgent. However, please inform us so we can advise you. If your implant was placed in the upper jaw, near the sinus, or if a sinus lift procedure was performed, there are a few additional precautions. For 2 weeks, please avoid blowing your nose, sneezing forcefully, creating pressure through your nose. If you need to sneeze, do so with your mouth open. This protects the delicate sinus membrane whilst it heals. You may notice mild bruising, slight stiffness when opening, a feeling of pressure. These are normal parts of healing. Dental implants heal through a process called osseointegration, where the bone gradually fuses to the implant surface. This process takes several weeks and careful aftercare protects it. Please contact us immediately if pain increases significantly after 3 days, bleeding remains heavy, or you develop a fever or unusual symptoms, or something just doesn't feel right. Early support protects your treatment. Your implant treatment has been carefully planned and precisely carried out. Healing is now a partnership between you and us. By following these simple steps, you're giving your implant the strongest possible foundation for long-term success. Thank you for trusting us with your care. We look forward to seeing you at your next appointment.
When you smile